Welcome to the deep dive. We take the sources you send us, dig in deep, and pull out the insights that really matter. We're here to help you navigate it all. Today, we're tackling something pretty serious, especially if you're around dogs, particularly puppies. Canine Parvovirus, CPV. Yeah, we've looked through the material you shared. It's really thorough, covers, what it is, spread, symptoms, diagnosis, treatment, and crucially, prevention. So our goal here, boil it down. Get to the must-knows. Make sure you understand why this virus is, well, still such a big deal.
And it's interesting, historically speaking, it's not that old. Parvo popped up in the late 70s, and the sources say it just exploded worldwide.
Wow.
Yeah. And even though we have good vaccines, it's definitely still a threat, a very present threat for unprotected dogs.
And here's something from the material that jumped out immediately. This virus is incredibly tough. Like, it can survive in the environment for months. And once a dog's exposed, things can escalate frighteningly fast, life-threateningly fast.
That combination is exactly why we still see outbreaks, the hardiness and the speed. Okay, let's unpack that then. Why is it so tough? What is this virus exactly, and how does it get around so easily? So the sources describe it as being in the Parvoviridae family. Key detail. Yeah. It's a non-enveloped, single-stranded DNA virus.
Non-enveloped. Okay, what does that mean practically?
Well, think of it like this.
Yeah.
Enveloped viruses have a fragile outer coating. Non-enveloped ones, like Parvo, don't. They're just inherently tougher, more resistant to disinfectants, heat, cold, drying.
Like a little biological tank.
Exactly. That's a good way to put it. And it's why the material stresses it can survive on, say, floors, bowls, kennels, for a very long time, months, potentially.
Okay, tough little tank. So how does it actually infect a dog?
Primarily the fecal-oral route. An infected dog sheds just massive amounts of virus in its feces.
Ugh.
Yeah. And then another dog comes along and gets infected either directly, sniffing or licking the infected feces, or indirectly.
Indirectly,
Meaning contaminated surfaces, floors, toys, bowls, or even people. Virus particles on shoes, hands, clothes.
Yeah.
Because it survives so well, indirect spread is really common.
Right, that environmental survival is key. So once it gets in the dog, what does it do? Where does it go?
It's quite specific. The material emphasizes it targets rapidly dividing cells. Think about what's growing fast in a dog, especially a puppy.
Okay, like the intestines.
Exactly. The lining of the intestines is a prime target. Also the bone marrow, where blood cells are made, and lymphoid tissues, which are part of the immune system.
So it hits the gut, the blood production, and the immune system.
Wow. Pretty much a triple threat.
Yeah.
The material does mention a rare cardiac form in very young pups, hitting the heart muscle cells. But it notes this is much less common now, probably due to maternal antibodies and early vaccines.
Okay, so let's connect those dots. You've got this super hardy virus, survives forever, shed in huge numbers, gets around easily, and then attacks the fastest growing, most vital systems in a young animal's body. What does that look like when it happens? What are the symptoms? Well, the signs usually pop up pretty fast, like 3 to 7 days after exposure. The material is clear. They can vary, but they're almost always severe, and they get worse quickly. This is the scary part for owners.
The classic signs, as the material describes them, are mostly gastrointestinal. We're talking really persistent, severe vomiting. And then profuse diarrhea. It's often bloody and has a very distinct foul smell.
Awful.
And complete loss of appetite, anorexia. Because they're losing so much fluid from both ends, they get incredibly tired, lethargic, and dehydrate really, really fast.
So it's not just a tummy bug.
Not even close. Then you have the systemic signs. The sources mention an initial high fever, but sometimes as the dog gets weaker, the temperature can actually drop below normal, which is a bad sign.
Okay.
Abdominal pain is common. The gut lining is severely inflamed. And you'll see rapid weight loss, especially in puppies, because they're not eating and losing so much fluid.
And you mentioned that rare heart form briefly.
Right, the material touches on it. Again, signs that are different: sudden death, maybe difficulty breathing, blue gums, weakness. But again, thankfully rare now.
The main takeaway seems to be the sheer speed and intensity, especially for puppies between, 6 weeks and 6 months.
Exactly. That age range is most vulnerable. It's easy to see how a tiny puppy could become critically ill very, very quickly with those kinds of symptoms.
Which makes diagnosis absolutely critical, and fast diagnosis too, right?
Absolutely vital. The material really stresses this. Early, accurate diagnosis means you can start treatment sooner, and that dramatically boosts the chances of survival.
So how do vets figure it out? What's the process?
Well, often the first clue is just the clinical picture, like the material says. A young dog, maybe unvaccinated or partially vaccinated, comes in with that sudden onset of severe vomiting and diarrhea. Parvo immediately jumps to the top of the list.
That gut feeling based on the classic signs.
Right. Then they move to specific tests. The most common one done right in the clinic is a fecal ELISA test. Yeah, it detects the virus antigen, basically, bits of the virus in the dog's stool. It's fast. You get results in maybe 10 minutes.
That sounds great. Super quick.
It is, but there's a catch the material points out. It can sometimes give false negatives.
Oh, why?
Maybe it's too early in the infection, before the dog is shedding a lot of virus, or maybe it's very late and shedding has decreased. So it's useful, but not foolproof.
Okay, good to know its limits. What else?
There's PCR testing that looks for the virus's DNA. It's much more sensitive, can pick up lower levels, but it takes longer. Usually it's go to a lab.
More accurate, but slower.
Exactly. And blood work is really important too. A complete blood count, or CBC.
What does that show?
With Parvo, it very commonly shows something called leukopenia, a really sharp drop in the white blood cell count.
The immune cells.
Right. Seeing that low count helps confirm the suspicion and also tells the vet how severely the immune system is being affected. It helps gauge prognosis.
Yeah.
And they'll also run a biochemistry panel to check electrolytes, kidney function, liver function, all crucial for guiding treatment, especially fluid therapy.
So it's kind of a combination approach. The quick test for a fast answer, but then blood work and maybe PCR for a fuller picture, and to understand how sick the dog really is.
That's a good summary, yes. Understanding all the pieces is key.
Okay, so let's say the diagnosis is confirmed. CPV. What's the treatment? Can you cure it?
This is a really critical point from the material. There's no specific cure for Parvo. No magic bullet antiviral drug that kills the virus directly.
Really? No.
None that's standard or proven highly effective. So the treatment is all about supportive care, managing the symptoms, fighting off secondary problems, and keeping the dog stable while its own body fights the virus.
Supportive care. What does that involve? Sounds intensive.
It is. And that's why the material says hospitalization is almost always needed. You need round-the-clock monitoring and intervention. Plus, isolation is vital to stop the virus spreading in the clinic.
Makes sense. So what are the main pillars of that supportive care?
Okay, number one, fluid therapy, intravenous, IV fluids. Absolutely essential. These dogs are incredibly dehydrated. The fluids replace lost water, electrolytes, sometimes glucose. In really severe cases, they might need plasma or special fluids called colloids.
Okay, fluids are critical. What else?
Controlling that severe vomiting is huge. So antiemetics, anti-nausea drugs are crucial. If you can stop the vomiting, it reduces fluid loss and allows the gut to start healing, maybe even allows for some nutrition.
Right, stop the drain.
Exactly. Then there's the risk of secondary bacterial infections because the virus damages the gut barrier and wipes out those white blood cells.
Bacteria can just invade.
Precisely. So broad-spectrum antibiotics are standard practice to prevent or treat those infections.
Okay. Fluids, anti-nausea, antibiotics. Anything else?
Nutritional support is also highlighted in the material. Getting some calories in, even small amounts, as soon as the vomiting is under control, actually helps the gut heal faster. This might mean syringe feeding or sometimes a feeding tube. And pain management for the abdominal pain.
Wow, that's a lot. It really is intensive care.
It absolutely is. The material mentions a couple of other things like using serum from recovered dogs, hyperimmune plasma for passive immunity.
Like borrowing antibodies.
Kind of, yeah. But it's not widely available, and the evidence is a bit mixed. Same for experimental use of drugs like oseltamivir. Tamiflu results are inconsistent, not standard care.
So the core message on treatment is it's not about killing the virus, it's about supporting the dog through the storm, helping their body win the fight.
That's exactly it. Critical care is the key to improving their chances.
Let's talk about those chances, the prognosis. What does the material say about survival rates?
The numbers are pretty dramatic. With that kind of aggressive supportive treatment we just discussed, the survival rate can be really good. The sources say over 80 or even 90%.
That's actually surprisingly high, given how bad it sounds.
It is, with treatment. But here's the flip side. The material also notes that without treatment, the mortality rate is incredibly high, like potentially up to 91%.
Wow. Okay, so treatment makes a monumental difference, life or death difference.
Absolutely. And the material points out some factors that make the outlook worse, negative prognostic indicators.
Like what?
Things like persistently low blood sugar, that severe drop in white blood cells we talked about, leukopenia, any delay in starting treatment, that's a big one. And if the puppy is very, very young or has other health problems already.
So getting help fast is just paramount.
It couldn't be more critical. Early intervention is everything.
Okay. Given how serious this is, how hard it is to treat, prevention seems like the way to go. How do we stop dogs from getting CPV in the first place?
Right. Prevention is obviously the best strategy, and the material lays out a few key approaches. The absolute foundation is vaccination.
The regular puppy shots.
Yes. CPV is part of the core vaccine combo that virtually all vets recommend. The typical puppy series starts around 6 to 8 weeks old. Then they get boosters every 3 to 4 weeks until they're about 16 to 20 weeks old.
Why so many shots?
It's about navigating the window where the mother's antibodies, which protect the puppy initially, start to fade, but before the puppy's own immune system is fully mature. The boosters make sure protection kicks in reliably. Then there's a booster at 1 year, and after that, boosters every 1 to 3 years, depending on the vaccine type and the dog's lifestyle risk.
Okay, so vaccination is number one. What else?
Hygiene. Remember how tough this virus is in the environment?
Right. Survives for months.
Exactly. So effective cleaning is vital if an area might be contaminated. The material specifically recommends a 1.30 bleach dilution, 1 part bleach to 30 parts water. It's one of the few things that reliably kills the virus.
Good to know. 1.3 of...
Also, common sense things like keeping unvaccinated puppies away from high-traffic dog areas, parks, pet stores until their vaccine series is complete, and just good general sanitation, hand washing if you handle different dogs.
Makes sense. What about quarantine?
Yeah, that's the third piece. If a dog is diagnosed with parvo, it needs to be isolated from other dogs for at least 14 days after symptoms start to prevent spreading it. And if you're bringing a new dog or puppy into your home, especially if you have other dogs, a quarantine period is a really good idea just to be safe.
Okay, so vaccination is the main shield. But because the virus is so persistent, that strong hygiene, especially bleach and smart quarantine, are really essential backup.
It's a great way to summarize the prevention strategy from the sources, yes.
All right, so wrapping up this deep dive on Canine Parvovirus, based on the material you provided us, we've learned it's this highly contagious, really resilient virus, hits puppies hardest, causes that awful rapid onset gut illness. Survival really depends on getting that intensive, supportive veterinary care and getting it quickly.
And the material definitely underscores that it's still a very serious disease, particularly for dogs that aren't vaccinated.
Yeah.
But, and this is a crucial takeaway, while it's dangerous, it's largely preventable through vaccination and good sanitation. And even if a dog gets sick, early diagnosis and aggressive treatment make a huge difference in survival rates.
Thank you for sharing this material with us. It's such critical information for anyone with a dog or thinking about getting one.
Absolutely. And maybe one final thought, just drawing from what the material highlighted, think about that environmental persistence again, the fact that this virus can survive for months on surfaces.
Yeah.
What does that really imply for shared dog spaces? Parks, kennels, groomers, even just sidewalks in the neighborhood. It kind of suggests that responsible dog ownership goes beyond just vaccinating your own pet, right? It's also about community hygiene, about being mindful of not spreading things to protect all dogs, especially those vulnerable puppies.
That's a really powerful point. Definitely something to think about, our collective responsibility. Okay, that's all for this deep dive. We hope this discussion helps you feel more informed about canine parvovirus.